This is Pratima Penumarti, founder and president of Volunteering for Seniors. We at Volunteering for Seniors, we listen, we respond, and we problem solve together, and we connect seniors to services, information, and resources that promote aging well and with independence. Since 2021, we have been conducting virtual webinars, talk shows, and conferences for senior citizens and keynote presentations, general sessions that basically focuses on supporting health and self-care for seniors and caregivers of older adults and individuals across USA. Today's topic is planning for Medicare Countdown to 65, and it is a very comprehensive virtual webinar that will help each one of you who is viewing today us or even will be watching us eventually will understand your health insurance options after your employer's plan has ended. Whether you are planning to retire soon or will continue working, this particular webinar will provide you with information you need to make informed decisions about your future healthcare needs. To begin with, people often confuse Medicare with Medicaid. So they are, in a little knowledge what I have about it, they're two entirely different programs. Medicare and Medicaid were both enacted as part of the Social Security Act, and programs provide comparable services. Medicare, as most of us know, they provide health insurance coverage to individuals who are age 65 and over, or under age 65 with certain disabilities, and individuals of all ages with the ESRD. So Medicaid provides medical benefits to, if you look at just the Medicaid, that provides medical benefits to groups of low-income people, some who may have no medical insurance or inadequate medical insurance. This is a general knowledge that most of us know about Medicare and Medicaid. So as per today's topic, we will be talking with William Rowbottom, who is a little bit about William Rowbottom. He has worked for Blue Cross Blue Shield for past 20 years. The first 17 years, he has worked as an account service consultant, working with both active and retired municipal employees, educating them about their benefits and any chances that may occur from year to year. He also co-presented with representatives from Social Security and is pretty well educated on Medicare. He travels all over the state of Mass, visiting councils of aging, as well as senior centers, doing presentations on Medicare and insurance that can definitely add to Medicare. He also does presentations on Blue Cross products for Blue Cross at events held at local hotels throughout Massachusetts, educating people who are approaching Medicare age, or even seniors who already have obtained Medicare and may be looking to take to make a change to their current additional insurance. So without further ado, I want to first hand over this entire session to William Rowbottom to start your presentation, and please give us more information about different types of Medicare and Medigap plans.
Thank you, Pratina and Ram. First of all, for inviting me this morning. I am delighted to be here to educate you on Medicare. I do work for Blue Cross Blue Shield. I work on the senior outreach team, and our job basically is to educate people on Medicare and what you can add to Medicare. And as you will see when we go through the presentation, you can stop at just original Medicare, but it is going to leave you with some out-of-pocket costs. So most folks do want to add some additional coverage, and we're going to go over that. So this morning's presentation is generic. I am not going to be talking about Blue Cross products. We're going to talk about Medicare and what you can add to it in a very, very generic form. There are several companies, including Blue Cross, that offer these plans that you can add to Medicare. But again, we're not here. This is not a sales meeting. We're here to educate you on Medicare and the different things that you can add to it. So we are going to follow an agenda today. This presentation is split up into two parts. The first part is Medicare and Medicare related options. The second part is options if you are retiring before you become Medicare eligible. That section is very short because there are not a lot of options, and unfortunately, it can be a very costly time if you decide to retire before you become Medicare eligible. So this screen right here basically says, this is Medicare is always your starting point. We all qualify for Medicare when we turn 65. And Medicare begins if you've paid into, you or a spouse has paid in Medicare taxes. We all qualify when we reach age 65. And Medicare, you're eligible for Medicare on the first of the month in which you turn 65. You also can be eligible if you are under 65 and have been in your 25th month of a disability. So an oversimplification of Medicare is that it's an 80-20 plan, with the federal government paying 80% of your medical costs through Medicare, leaving you with 20% liability. Now, as I said, you could stop right there, but most people want to add additional coverage because that 20% can be quite costly. So there are two distinctive pathways that you can go. You can, on the left-hand side of the screen, is what we call Medicare supplement plans. What these do is they fill in the gap. So they fill in that 20% that Medicare does not cover. But keep in mind, if you choose a Medicare supplement plan, it does not have prescription coverage. Neither does original Medicare. So you would have to purchase a standalone Part D prescription drug plan. So that's one route. The other way that you can go, and it's either or, you never do both, are what we call Medicare Advantage plans, also known as Part C or optional replacement to Medicare. And most of these plans include your Part D prescription drug coverage built right into them at no additional cost. And then they add in some extras, like some money towards glasses, maybe some preventive dental. It varies from company to company. So we are going to go over all of these blocks and go into everything. But just to, again, start from the beginning, original Medicare, Parts A and B. A is usually premium free for most folks. Part B for 2022, again, for most people, is $170.10 per person per month. If you fall into a lower or higher income bracket, that could change, but that's the average that most people pay. So if you went the left-hand side, you would have your Part B premium. You would have a premium for your Medicare supplement, and then you'd have a premium for your Part D. So three premiums. So a bit more costly, but little or no money out of your pocket when you seek services. The other way, again, you're starting with your original Medicare. So you're going to have to pay your Part B premium. And then this Medicare Advantage plans, like I said, are all inclusive. Your medical coverage, your prescription drug coverage. They act very much like your work plans. They are HMOs and PPOs, and you pay as you use services, just like you did on your work plans. You go to a doctor or a specialist, you're going to pay $10. You go for physical therapy, you're going to pay a copayment. So very much like your work plans. So again, just to review, original Medicare, your starting point, Parts A and B. You can go to the left-hand side, add a supplement and a prescription drug plan onto it, or you can go the Medicare Advantage plan route. So what is original Medicare? It is health insurance provided by the federal government. We have a picture of what a Medicare card looks like on the right-hand side. Part A pays for your inpatient care. And again, this is premium free for most folks. Part B pays for your doctor services and outpatient care. And again, it has a premium of $170.10 per person per month, again, for most people, unless you fall into a higher income bracket. Part B, think of it as anything that is not done while you're inpatient. So you're talking about doctors, specialists, physical therapy, day surgery, durable medical equipment, ambulance. All of that falls under your Part B of Original Medicare. So how does Medicare work? You can see any provider nationwide who accepts Medicare. It is not a managed care plan, so you don't need to have a primary care physician, and you do not need to get referrals to see specialists. Again, if you just have Original Medicare, you are going to be left with some deductibles and co-insurances. So how and when to enroll? Most folks are going to find themselves in one of the three categories that I'm going to talk about next. So the first one is, if you turn 65 and you are collecting your Social Security check, then you should automatically receive your Medicare card 3 months prior to your 65th birthday. So it's automatically going to come to you if you're collecting the monetary check that comes from Social Security. And as I mentioned before, coverage starts on the first of the month on your 65th birthday. The only exception to that rule, and this is a Medicare rule, is if you are born on the first of the month. So let me give, your coverage will start the first of the previous month. So let me give you an example. My birthday is March 7th. My Medicare is going to start March 1st. Had I been born March 1st, my Medicare would actually start February 1st. So that's one scenario. Another one, if you turn 65 and are not collecting your Social Security and you want your Medicare coverage to begin, you have to be proactive. You have to contact Social Security. And Social Security suggests that you contact them 3 months prior to your 65th birthday. Do not try to apply any sooner than 3 months. So if you went 6 months before your 65th birthday, they would turn you down and tell you to come back. So 3 months is before your 65th birthday is the earliest you can sign up for your Medicare. And when you're first turning 65, you're in what's called your initial enrollment period. So under this initial enrollment period, you can sign up for Medicare starting 3 months prior to your 65th birthday, the month of your birthday, and 3 months after your 65th birthday. And the last scenario is if you continue to work past age 65, and we're finding more and more folks are doing this today, you contact Social Security to enroll in Part A, but you would want to delay signing up for Part B beyond age 65. And you can do that without a penalty as long as you have group insurance from an employer that has 20 or more employees for whom you or your spouse are actively working. If you work for a company under 20 that has under 20 employees, I suggest you contact a human resources department because those companies sometimes do require you to take both Part A and B of Social Security. But again, that's a company decision. If when you or your spouse stops working or your health coverage ends, then you'd be entitled to what's called a special enrollment period. So say you decided to work past 65, say you decided to work to your 68, and you go to Social Security to enroll. They may ask you, where have you been since you turned 65? And you tell them, I was actively working with employer coverage, and they're simply going to give you a very short form, which you would bring back to your employer, and they would fill it out, and you add that to your application to Medicare. So then they know that you've had coverage, and there'll be no penalties because you didn't take your Medicare at age 65. Now, the only time that you would not want to even take Part A of Medicare when you're still working is if you have what is called a high deductible plan. And most high deductible plans have a financial vehicle attached to them called a health savings account, which helps defer the cost. You can use those monies to help pay for copayments, things like that. So if you fall into that bucket where you have a high deductible plan with a health savings account, you actually have to, once you apply for any part of Medicare, you have to stop contributing to your health savings account. And actually, Social Security suggests that you stop contributing 6 months prior to stopping employment. But that, again, is something you can take up with Social Security. So those are the three, again, I call them buckets that one may fall into as they are approaching Medicare eligibility. So now, again, we're going to talk about original Medicare. So we'll start with Part A. If you just have original Medicare and you go into the hospital and you are there from days 1 through 60, you're going to be asked to pay $1,556 when you enter that hospital. And this is based on what's called a benefit period, and I will come back to that. If you're still in the hospital from day 61 through 90, again, with just original Medicare, you're going to be asked to pay $389 per day. And if you're still in the hospital from days 91 through 150, you're going to be asked to pay $778 a day. And there's no coverage after day 151. Now, the benefit period. The benefit period begins the day you enter the hospital. So let me give an example. It's easy to do that. So let's say you go into the hospital, you just have original Medicare, you're admitted for 5 days. You're going to have to pay that $1,556, and then you're discharged. 2 weeks later, you end up back in the hospital. You're still within that 60-day window or benefit period. So you would not have to pay that $1,556 again. However, let's switch that around a little bit. And you go into the hospital, you're in there for 5 days, you're discharged. 3 months later, you end up back in the hospital. You've passed that 60-day benefit period window. So you'd have to pay that $1,556 again. So that's why we always say, if you just have original Medicare, it can be costly, especially if you have multiple hospitalizations. Original Medicare Part A also covers skilled nursing facilities or rehabilitation hospitals. Now, this is a place that you go after you've been in the hospital, you're not quite ready to go home, you need more care, but you don't need to be in an actual hospital. So as long as you have a 3-night overnight stay in a hospital, Medicare is going to pay the first 20 days of your skilled nursing or rehab hospitalization at 100%. If you're still in there from days 21 through 100, you're going to be asked to pay $194.50 per day. And there is no coverage after days 100. So Part B, a little bit easier to explain. Under Part B, you are responsible for a Part B deductible every year at the beginning of the year. For 2022, that figure is $233. So you go to the doctors, they send you a bill, you're responsible for the first $233 right at the beginning of the year. Once you satisfy that deductible, it's going to become an 80-20 split. And again, here's some more examples of what Part B covers: doctor's visits, labs, x-rays, emergency room, ambulance, physical and speech therapy, diabetic supplies, durable medical equipment. Some things that are not covered by original Medicare. We mentioned in the beginning, outpatient prescription drugs. So that's where if you went, you know, this route, you would have to buy a separate, if you wanted your drugs covered, you'd have to buy a separate Part D prescription drug plan. And there are Part D plans out there that start at around $18 and go up to as high as $300. So, and again, original Medicare, if you are traveling outside of the United States and this is your only insurance, you do not have coverage. And it does not cover routine vision or routine hearing exams or any routine dental care. So again, now we're on that left-hand side of the screen where we started with original Medicare, and then I said you can add a supplement or a Medigap plan. You may have heard both of those terms, Medigap and supplement plan. They mean the exact same thing. So it is a plan that you add to original Medicare, and it helps pick up those deductibles and co-insurance costs for you. So in Massachusetts, Minnesota, and Wisconsin, Medigap policies are standardized in their own way. We have 3 of them, and I'll get into more detail in the upcoming slides. The rest of the country has 10 standardized plans. So how you receive your care. When you have original Medicare and a supplement plan, you're going to show 2 cards, your Medicare card and your private insurance card. The bills will be sent to Medicare. They'll pay their 80%. Then they'll be sent back to the insurance company, and they will pick up the difference based on the plan design that you choose. And again, just a reminder, you can see any Medicare provider nationwide, no referrals, and no copayments. A lot of flexibility with Medigap plans. So these are the 3 standardized plans in Massachusetts for all insurance companies, not just Blue Cross. And they are regulated by the Division of Insurance. Easiest way to read this chart is everywhere you see a green check mark, it means between Medicare and the supplement plan that you have chosen, it's covered at 100%. So let's start with supplement 1, because that's the easiest one. You can see there's check marks all the way down. So if you chose supplement 1 between Medicare and your supplement, you would have literally have no out-of-pocket costs. So how much does supplement 1 cost? They range, let me see, they're about $225 per person per month. And there is a law that was passed back in 2020, which says that to purchase supplement 1, you had to have been Medicare eligible prior to January 1st, 2020. So anybody that's not 65 yet can't join that plan. But say you turned 65 back in 2019 and you're still working, you would be eligible for that plan. But not to worry for those folks that are not eligible, because supplement 1A was introduced right when that law came into effect. And as you can see, it's very similar. You can see check marks all the way down, except for the Part B deductible. So once you pay that $233 at the beginning of the year, supplement 1A is going to act just like supplement 1. You're not going to have any more out-of-pocket costs. The price for supplement 1A averages about $175 per person per month. Then there is supplement core. The price on this one is about $100 per person per month. And as you can see, there are some empty boxes. So if you chose supplement core and you went into the hospital, you would be responsible for that $1,556. If you were transferred to a skilled nursing facility or a rehab hospital, days 21 through 100, you'd be responsible for that $194.50 a day. And you'd also be responsible for your Part B deductible of $233. Now it says care received out of the United States. That's a nice part of adding these supplement plans. You now have coverage if you do travel out of the United States. There is not a green check mark under core because not all companies cover it. I will say that at Blue Cross, we do have international coverage if you chose the core plan. So there's also what we call continuous open enrollment with Medigap plans. So let me give an example. Say you decided you wanted to sign up for core because you wanted to keep your costs down. And you went to the doctors and they said, oh, we're looking at a knee replacement. Well, those aren't done usually the next week. They're usually planned at least a month out. So what you could do is you could call the insurance company and you could ask them to upgrade you to supplement 1A. And it's always would become effective the first of the following month. And then you wouldn't have to pay that $1,556. And what I always say to people is once you've had the surgery, you've had all of your PT, and more importantly, the doctor gives you the clearance, says everything looks great. Then if you wanted to go back down to core, you could do that. So that's a nice part. You can, there's a little bit of flexibility between the supplements. This chart right here, I'm not going to get into it. These are the plans outside of Massachusetts. Not all insurance companies have to offer all of these plans. So if you were moving out of state and we're looking at purchasing a plan out of state, you could contact the insurance companies directly, or there is a resource called SHIP, serving the health informations of people on Medicare. And you could contact them. They could help you help you to look at plans and determine what might be best for you. But again, the insurance companies don't have to offer all of these plans. Just to go back for a second, if you purchase a Medigap plan in Massachusetts, while you are residing in Massachusetts and move permanently out of the state, and I'm only speaking on Blue Cross's behalf, I don't want to speak to the other plans, but if you purchased it while you were living in Massachusetts, you can take it permanently with you if you move out of the state. But some people may want to look at some of these plans to see if maybe there's a better plan or a less costly plan, but hold on to your current plan until you really perhaps meet with a SHIP counselor and decide what works best for you and your budget and your health concerns. So now we talked about original Medicare. We talked about supplement plans. We're still on the left-hand side of that screen. And I said, supplement plans do not have prescription drug coverage. So you'd have to buy a standalone Part D prescription drug plan. And as I mentioned, these can range in price from $18 all the way up to $300. But what is most important about choosing a Part D plan is you want to choose a plan that covers the drugs that you are currently on. So what is Medicare Part D? Unlike Part A and B, where you go to Social Security, with Part D, you purchase Part D prescription drug plans directly through a private insurance company. And these insurance companies, like Blue Cross, are contracted with the Centers for Medicare and Medicaid Services to cover outpatient prescription drugs. So your cost is your premium to the insurer. Again, plans starting as low as $18 a month. And all Medicare Part D plans, regardless of who the company is, have to follow a standard outline of coverage as determined by the Centers for Medicare and Medicaid Services. And these three coverage levels are the initial coverage, the coverage gap, and the catastrophic coverage. And I'll go into a bit more detail again on the upcoming slides. So the plan designs within these levels, such as any deductible, any cost sharing, the formulary, and the pharmacy network, all of those things help determine what the insurance company will charge for a monthly premium. So Part D, this is how it works. And again, it's going to vary a little bit from company to company as far as co-payments, but this is a generalization. So you may have a deductible for some drugs. Usually those are your more costly drugs, but your deductible will never be more than $480 in a year. So, and then after you satisfy the deductible, you move into the initial coverage. So every year, the federal government determines a certain amount of money under these Part D plans that they will they'll give you or allow you for the total cost of your drugs for that year. So the cost for the figure for 2022 is $4,430. So in the initial coverage, you have that $4,430 to work with. So say you purchase a plan and you go pick up a prescription and your copayment is $10. So you pay $10, but the actual cost of that medication is $100. So you're going to pay 10, the insurance company is going to pay 90 on your behalf, but that total 100 is going to be subtracted from the 4,430, leaving you with 4,330. And that will continue throughout the year as you pick up prescriptions. Now, for some folks, that may be enough money to last them the entire year. Excuse me. But for others, you may use that money up. And if you do, it's going to move you into what is called the coverage gap. That used to be known, some of you may have heard this term, the donut hole. And years ago, you would pay the full price when you moved into the coverage gap. Now, if you move into the coverage gap, you're going to pay 25% for your generics or 25% of the negotiated price for brand name drugs, excluding any dispensing fees. And the dispensing fee is just $1 or $2 that a pharmacy may charge you to dispense a medication. Then, if you have really costly medications or multiple medications, and you spend out of your pocket, so your portion, that copayment every time you go, so any deductible, any copayments you pay in the initial coverage, any 25% in the coverage gap, if that adds up to $7,050, then you're going to pay the greater of 5%, or $3.95 for generics or drugs treated like generics, or $9.85 for all other drugs. Now, I realize that's quite a bit of information, and most insurance companies don't expect you to track this. They send out monthly statements. If you're on maintenance medication and you get something every month, you're going to get a statement from the insurance company saying where you stand, whether you're still in the initial coverage, whether you've used that money up and moved into the coverage gap, or if you've used all of that up and you've moved into the catastrophic coverage. So they are tracking that for you. Okay, so now we've covered original Medicare, we've covered Medicare supplements, and we've covered Part D plans. Now we're going to move into Medicare Advantage plans. Again, as I mentioned earlier in the presentation, these are going to feel very similar to your work plans. They're HMOs and PPOs. So what happens with a Medicare Advantage plan is that Medicare pays the plan, the insurance company, to provide your Medicare benefits. So, and then the plan also provides additional benefits that Medicare doesn't cover. As I mentioned earlier, maybe some eyewear allowance, some preventive dental, again, varies from company to company. The nice part on Medicare Advantage plans, one card, whether you go to the doctor's, hospital, or pharmacy, you show your Medicare Advantage card. And just a reminder, you must always continue to pay your Medicare premiums, your Part B premium. So Medicare Advantage plans, price range, there are plans that start at $0 premium and go up to $300, but the most popular plans range from $0 to $100 a month. And remember, these are all inclusive. It's your medical, your prescription drug coverage. So that Part D model I just covered is built right into that plan. And they throw in some extras. Like I said, maybe some money towards eyewear or some preventive dental care. So the Medicare Advantage plans provide all of your original Medicare benefits, Part A and B, in addition to some extra benefits, such as now under these plans, you get a routine vision and hearing exams, which you don't get under the supplements or with just original Medicare. You do get some preventive dental, and most Medicare Advantage plans do include prescription drug coverage. Again, very important to check with whichever company you decide to go with. So in exchange for that, like your work plans, member pays co-payments and co-insurances when services are received. So this is just a short illustration of the difference between an HMO plan and a PPO plan. Under a Medicare HMO plan, you are required to designate a primary care physician. You are required to use in-network providers. And as I mentioned, you're going to pay co-payments or co-insurances as you seek services. Under a PPO plan, you have a bit more flexibility or a bit more freedom. It is suggested that you designate a physician of choice. They call it a different name because you don't have to go back to this physician of choice to get a referral like you do to your primary care physician. The nice part of the PPO plans is you can use in or out of network providers. But keep in mind, if you go out of network, your out-of-pocket costs are going to be a bit higher. And again, you're going to pay co-payments and co-insurances as you go along. And you do not need to get referrals to specialists. It says to view Medicare Advantage plans, you can refer to the Medicare and You Handbook. You can actually, not sure if they still mail those out, but they do have a PDF on Medicare's website, medicare.gov, where you can download that. It's a wealth of information, tells you everything you want to know about Medicare. So now we're going to talk about when can you join these plans, Medicare Advantage plans? During your initial eligibility that we talked about, 3 months before your 65th birthday, the month of your birthday, 3 months after. And again, you're eligible in your 25th month of a disability. Annual election period. This is the most popular time, and you will know when this is coming because you will start seeing all the commercials on TV. Your mailbox will be full of all kinds of information, everybody wanting your business. This annual election period runs from October 15th through December 7th for an effective change date of January 1st. This is when you can pretty much do anything. You can go from a Medicare Advantage plan to a supplement plan. You can pick a new Part D plan. So again, this is a popular time, and it's important. It's like when you had open enrollment with your work plans. You want to take a look at all the plans out there, see what the changes are. Have the premiums changed? Have the co-payments changed? What enhancements does one have over another? Then there is another enrollment period called Medicare Advantage enrollment period. This is only for people that are already enrolled in a Medicare Advantage plan. So say you enroll in a Medicare Advantage plan, let's say you do it for August 1st, and you join it, and after you've been in it for a few months, it comes January 1st, you say, you know what, this either my doctors aren't in here or I just don't like the way that this is working. There's what I call a mini open enrollment period from January 1st through March 31st, where you can change to another Medicare Advantage plan, be it the same company or another company, or you can go back to original Medicare and go the other route, pick up a supplement plan and a separate Part D plan. Then there's lastly, what we call special enrollment, open enrollment. So this is perhaps you've lost your employer coverage either voluntarily or involuntarily. That would open up a special enrollment. You've moved in or out of a planned service area. That also opens up a special enrollment period for you. So I mentioned at the beginning that most people are going to pay $170.10 per person per month for their Part B. But if you fall into a higher income bracket, you potentially could pay what's called an IRMA charge. So you could pay additional. So this is just a chart. This is also on Social Security or Medicare's website. Let's just say if you're an individual making $91,000 or less, or a couple making $182,000 or less, you're going to pay that $170.10. But if you fall into those higher income brackets, you could pay some extra money for both your Part B and your Part D. So again, this is something you take up with Social Security when you're first signing up. And this could change. They look at your income taxes for the past 2 years, and that's how they determine the premium. So if your income changes and you did fall into one of these higher income brackets and then your income lowers, your Part B could go down and your Part D could down as well. This is our resource slide. We've listed Medicare's telephone number and website. Social Security office, the SHIP, remember that's for out-of-state plans. There's their website there. Shine are counselors in Massachusetts, serving the health information needs of everybody on Medicare. You don't necessarily need to call that 800 number. You can find Shine counselors throughout the state at your senior centers or council on aging. These people are volunteers, and if you set up an appointment with them, you can sit down with them for about 45 minutes to an hour. They will look at all of your needs, how much you can afford, what your medical conditions are, what prescriptions you're on. And again, I always say they don't work for any insurance companies. They have no skin in the game, if you will. So they're not going to point you towards one company over another. They're simply going to look at what your needs are, what you can afford, and help you make that very important decision. Mass Medline. This is through the Mass College of Pharmaceuticals in Boston. This is where you can call. They can look up your medications for you. Say, I've actually used them. I changed a medication. I wanted to know if it had side effects. I called them. I actually talked to a pharmacist. So it's free to all Massachusetts residents. Terrific program. Prescription Advantage program. I cannot say enough about this program. This is a plan that is run by the state of Massachusetts, and this is to help people with their prescription drug costs. They only look at your income, and their income levels are quite generous. So I encourage anybody that has high cost prescriptions or multiple medications, give them a call to see if they can help you out. And lastly, we've listed Blue Cross's telephone number and website in the event that you want to look at our plans. All of them are listed on our website. We also do Zoom meetings and live meetings if you want to come to one of those as well. Okay, so we've gone through section 1. I know that was a lot of information to take in. And now we're going to move on to section 2. This, again, is if you are options, if you're retiring before you become Medicare eligible. And there basically are 3 options when you retire under age 65. Spouse partners plan, COBRA, or direct pay. Some things to consider: access to current or desired providers. You want to make sure that the benefit design meets your needs, and probably the most important thing, cost. So we've listed them in the most popular way. Spouse or partner plan is your best bet. If you have a spouse that you could perhaps join their plan, that would be your best bet, because remember, the company is paying part of the premium, usually at least 50%. But every company has different rules, so important to check with the Human Resources Department to see if you can go onto that plan. And if the premium would be deducted from your spouse's paycheck. So that's one option. COBRA. COBRA is probably the easiest to understand because it's the exact same plan that you are coming off of. And under COBRA, it's with your current employer group. So it's the same plan, but now you're paying 100% of the premium. And they can actually charge you up to 102% because by law, they're allowed to charge a 2% administrative fee. Again, easiest to know because you know the plan already, you know the benefits, you know the co-payments. Employees, former employees can generally stay on COBRA for 18 months, and their spouses or dependent children can stay on it for 36 months. Some qualifying events for COBRA are termination of employment, divorce or legal separation or death, or verify if you perhaps have a qualifying event with the employer or the plan sponsor. And again, you're paying 100%. And lastly, you could look at direct pay plans, call the different companies, call Blue Cross, call Tufts, call Harvard. If you're not eligible for a group employer coverage and you don't qualify for state or government programs, Medicare, Medicaid. So you look into direct pay plans. Now, you might not need, say you run a family plan, maybe you don't need a family plan. Maybe it's just you and a spouse, or maybe it's just you that needs coverage. So you're gonna call these companies, they're gonna ask for your birth date and your zip code. And then that's how they determine the premium. And I will tell you that unfortunately, this is a very, very costly time. To give you an example, somebody age 63, individual seeking insurance could be looking at $800 a month for premiums. So that's why another source is the Mass Health Connector, because you may qualify for a subsidized plan depending on what your income is. So again, you can call the companies, get a quote from them. Also go to the Mass Connector site to check there to see if you can get a plan at a lower cost. Again, a very expensive time if you're retiring before you become Medicare eligible. So we have concluded. It is time for questions.
Yeah, Bill. So if you can remove your screen share, if you're not going to use your presentation, then what we'll do is that we'll invite. I think Pratima will start.
I'm going to ask a couple of questions.
We'll start a session with some questions to you, and then we can open up the floor for rest of the participants.
Okay.
Thank you very much, Bill. It was very, very informative session. Honestly, it was like too much to take it in one day. I was trying to note down and I was like, it is literally going, I need to go through the entire thing again. But I have a couple of questions which I noted while you were speaking. Is one of my questions which I was thinking is that there are people who can't afford, the Medicare premiums. If they are, for them, what are the different options? What can they do?
If they can't afford the Medicare premiums?
Premiums, yeah.
They still should contact Social Security because there are what we call special needs programs out there. Mm-hmm. We don't get into them because we don't offer them, but they're for lower income folks that may qualify for Medicare or Medicare and Medicaid. There's all different kinds of plans. So Medicare, they would contact somebody at Medicare to check into that.
For the premiums. And
correct.
If someone, can they be enrolled in both Medicare and Medicaid at the same time?
Yes, but not take one of these plans. That would fall under a special needs plan if you have Medicare and Medicaid together. So again, you'd go back to Medicare to find out what programs they have and what costs they are. Okay. But these plans are for people who direct pay and do qualify for Medicare A and B, but no Medicaid.
Also, Bill, can one deduct because they're going to pay so much of Medicare premiums, mm-hmm. They deduct their premiums on their tax returns?
That would be something be better answered by their tax preparer or financial planner.
Okay.
I know it varies. I used to work for a small company, and I know the owners were able to deduct a portion of their premiums, but that was many years ago. So the rules may have changed.
And we're explaining about this advantage plans, right? And the supplements. So again, I'm a little confused, and I don't know, probably others must have understood, but which is better, an advantage or supplement plan?
That's a great question. We get it at every seminar that we give. It is a very personal choice. Again, just that's why I wanted to go back to this screen. Left-hand side, you're paying Part B, you're paying a premium for your supplement, you're paying a premium for your Part D. So more premium dollars, but little or no money out of your pocket when you seek services. The Medicare Advantage plans, on the other hand, all inclusive, Medicare, your medical coverage, your prescription coverage, some extras, all for one premium starting at $0. So one could simply, for example, if they really wanted to keep their costs down, they could pick a 0 premium plan. So their only cost really is $170 for their Part B premium, and then any co-payments when they go to the doctors. So again, very individual decision, but also, you know, does one like the flexibility of the supplement plans where you can, you know, pretty much take it anywhere, go anywhere, live anywhere, or the Medicare Advantage plans, you know, do have service areas, you know, and sometimes you have to stay within the network of doctors. So again, they're like your work plans. There's certain rules and regulations. So do you want more flexibility and freedom, or are you willing to pay, you know, follow the plan rules and pay little or no premium?
Sure. There's one question from one of our, from Sangeet, but I just have one quick question too here is, you mentioned about the premiums which keep changing, but how much do you think is, or I'm not sure, like, you know, the premiums, the Medicare premiums increase each year?
Yep. That's a great question. In the past, Medicare premiums usually went up a few dollars a year. And then last year we had that huge increase. That was, I think, $20, $25 per person per month. It was 140, I believe it was 146, and it went up to 170. Again, that's regulated by the federal government, has nothing to do with the insurance companies. So I can't predict what's going to happen in 2023. But that's where you might want to, you know, I've always told seniors over the years I've worked with them, you know, the senior population has a very strong voice. If you don't like your coverage or premiums, say your premium Part B, this is when you need to contact your senators and representatives. Wow,
yeah, that's a long work for everyone.
Yes, I know.
Big work contacting the senators. Another thing, which, because I know some people use Medicare and Medicaid.
Yep.
Am I right if I say that if they have both, the primary is Medicare?
Yes.
Medicare
yes.
is the primary payer.
Yep. Yep.
So you mean that all the services, they first get coverage from Medicare, and anything that Medicare does not cover, Medicaid will pick up?
It's not always 100%. And again, that's why if somebody had Medicare, Medicaid, that's where the Shine counselors come in, because they go through extensive training on those special needs programs. So they would you'd probably get more information from them than you would if you went back to Medicare or to Medicaid directly.
Sure, yeah. I know one more thing you mentioned about, you know, in the list which you are showing about hospice, but how does Medicare cover one's hospice care?
Hospice is covered under Medicare Part A.
Part A. So,
yes.
Yeah, so the entire thing, right? There.
Yes.
Stay,
yep.
Okay. Stay.
Yep.
Okay. So just going through, I think Sangeet, do you want to ask your question?
Sure. So my father never worked here. He did not pay into Social Security. but now he's immigrated. He's going to be with me because a year ago he got a green card.
Yep.
I was told that he can only get it if he becomes a citizen. And then there was another phone call with someone else who said, oh, if you never paid into Social Security, we don't have that option. So that really confused me, and I don't know where exactly he stands.
The second answer that you got is the correct answer. You have to have paid into the Medicare system to apply for it. So he would have had to.
In that case, what medical coverage options does someone like him have?
It's a tough one.
If it's a tough one, we can let that slide by, and I can have a conversation with Pratima some other time.
Yeah, it is a tough one. You basically probably are going to have to do a direct pay plan.
Oh, like the health connector?
Or the health connector, absolutely.
Thank you, Sangeet. And Bill, I have one more question. I think
Sure.
if they're first-time Medicare, if they're Medicare recipients, they may not be aware that they may not be, it depends upon how many things, but they may not be aware to pay the monthly premium for their Part B, which you mentioned, which covers mostly medically necessary and preventive care services. So it's my concern it's not generally for a few percentage, but everyone, but you were talking about, like with premium amounts ranging as low as 170 to as high as almost like 578 or something, right? This impact can be significant on the person's financial needs.
Yes.
It's a huge impact. So I was trying to figure out, it's not like everybody can pay that.
Right.
So what's the answer? Is that like only one has to, there's no other help for them, right? Is there any way they can, who's the best one for them to approach and speak about these things?
Well, the federal government comes up with that premium every year. And again, if someone could not afford the Part B premium, that's where they would fall into the special needs programs. So they're called NSPs, special need programs. So there could be some assistance there. For those folks that make, that have to pay the extra because they're in a higher income bracket, the federal government looks at it like, to be perfectly blunt, that if they're in that income bracket, most likely they can afford to pay a bit more money for their Medicare. But for those folks that are on the other end that don't have the money to pay the 170, that's when you would contact Medicare to see if you qualify for those special needs programs.
So any other questions? Anyone wants to ask any question to Bill?
Can you show the Part A premium screen, please?
Sure. There it is. It's actually Part B. Most people don't pay for Part A. It's your Part B and your Part D that you may have additional costs.
No, Part A hospital coverage.
It's 170.10 for most people.
No. This is Part B. Part A that you pay first deductible.
Part A is free for most people.
No. The hospital first deductible.
Oh, the costs for the hospital if you go in? Okay.
Yeah.
Let's go back. Oh, there it is. 1556.
1556. But these are Medicare. This is supplement plan. Before this, you shown the another one.
The Medicare Advantage plans. We didn't list an inpatient cost, but that's a great question.
No, Bill, not Advantage. Before this, you went to, when you started the slide, the very first one.
Okay, let's go back.
This one.
That one, yeah.
No. Next one.
Passed out, yeah.
Next one. Yeah, this one, please. Just hold.
Okay. Yep.
Yeah, I got it. Thank you.
Okay, great.
Yeah. Any other questions?
Thank you, Bill.
You're welcome.
Also, I think I have asked, Part D is something I myself have to go through a lot because I know it is all prescription drug coverage, right?
Part B?
Part D.
D is, Think
It's
of drugs. Yeah.
Yeah.
Part D is your prescription drug
So
coverage.
as you said, Bill, so it helps to pay for the generic drugs and the brand names for both, right?
Both. By law, it has to pay for generics and brand name drugs. And there is I'm doing this because I'm doing some recertification. Under all Part D plans, there has to be a drug classification for every single drug. So if you take a very expensive drug and it's not in that company's formulary, they have to have an equivalent that may or may not work for the patient. That's when the doctor gets involved. You know, it may work for them, but if for some reason they're allergic to it, they just can't take it, they have adverse reactions, then one can always inquire or apply for what's called a formulary exception. And under that case, what happens is the insurance company would give you a 30-day supply of medication while you had a discussion with your doctor to see if there's another drug that they can use until such time. And if the doctor gives enough medical information to the insurance company, often they will approve that formulary exception and pay for that drug that is not normally on the formulary. But there has to be a lot of backup work saying, you know, they can't take it. They've tried X, Y, and Z. None of them work, or they have bad reactions. This is the only drug that works for this condition. So it's called a formulary exception. And you can always apply for one of those, whether you're on an active plan or a retiree plan.
Sure. Also, I just wanted to run what you mentioned about the Part A. If anyone has missed it, I mean, correct me if I'm wrong, Bill, you said that even home healthcare services are covered by Medicare Part A, right? Like intermittent skilled nursing care or physical therapy.
Part A is your inpatient cost. So we're talking about inpatient hospital, psychiatric hospital, a rehab hospital, or a skilled nursing facility, not a nursing home. No insurance company covers nursing.
What about
homes.
the home healthcare services?
That would fall under Part B.
Oh, it's on Part B?
Part B, yep.
Thinking about that, okay. So yeah, I think it'll take more time for us to even brush.
It's a lot of information. It's a lot of information.
Yeah.
You know, I still continue to learn as people ask me questions. You know, sometimes I have to say, you know what, I got to look into that and get back to you. So yeah, that's, again, I cannot say enough about the Shine counselors because they go through so much education on all of those special needs programs that we talked about. They know all the different companies. They can actually, well, there's a tool on Medicare's website. We
actually we're connecting with a Shine director from HESCO. And
great.
They are agreed to come and also share.
Wonderful. It'll
be very helpful.
Yeah.
Thank you so much, Bill. I just want to
Thank you.
for everyone through, I think, helpful resources and tools, one can discover more information that we all need to make confident Medicare decision. And again, just to say again, thanks. Again, we at Volunteering for Seniors, we believe relationship-based volunteer services are ideal, and our goal is to connect people to resources like what we did today and promote aging with independence and increase community awareness of aging issues and generate community-based solutions. And also if those who might be interested to volunteer with us, when you volunteer, you're going to make a difference in your community, your neighborhood, and yourself. So thank you everyone who's been here, and I'm pretty sure it's been a little inundated with a lot of information today, but we'll have more such sessions in the future. Thank you again all.
Thank you, Pratima ji.
Thank you, Narayanji. Yeah.
Thanks, Pratima garu. Bye.
Thank you, Karthik.